What is a PCR test for TB diagnosis? Imagine a test that can find tiny pieces of bacteria in your body almost instantly. That's what a PCR test for tuberculosis does. It uses a special process called polymerase chain reaction to find the genetic material of the bacteria that cause TB. This bacteria is called Mycobacterium tuberculosis. The test looks for specific DNA sequences that are unique to this bacteria, making it very precise. The process starts with taking a sample from the patient, like sputum from the lungs, blood, tissue, or other body fluids. The PCR machine then copies these tiny DNA pieces many times over. This amplification makes it easier to detect even very small amounts of bacteria. The test targets specific parts of the bacteria's DNA, such as insertion sequences like IS6110 or IS1081, which are repeated elements found in the bacteria's genetic code. Because of this, PCR can identify TB bacteria quickly and accurately. One of the biggest advantages of PCR testing is speed. While traditional methods like growing bacteria in a lab can take weeks, PCR can give results within hours to a day. This rapid turnaround helps doctors start treatment sooner, which is crucial for patient health and preventing the spread of TB. PCR is also very sensitive, meaning it can detect TB even when bacteria are present in low numbers, which is especially helpful in cases of extrapulmonary TB or in patients with weakened immune systems. PCR testing is versatile. It can be used on different types of samples, including sputum, blood, or tissue biopsies. This makes it useful for diagnosing both lung and other forms of TB. For example, in patients with HIV or other immune conditions, PCR can help identify TB that might not be visible through other tests. However, PCR isn't perfect. Its sensitivity can vary depending on the sample type and how much bacteria is present. Sometimes, if the sample has very few bacteria or contains substances that interfere with the test, it might not detect TB even if it's there. Also, PCR detects DNA from bacteria whether they are alive or dead, so a positive result doesn't always mean active infection. It's important to interpret PCR results alongside other tests and clinical information. PCR tests are performed in specialized laboratories with trained personnel and requiring specific equipment. They are often used together with other diagnostic tools like chest X-rays, sputum microscopy, bacterial culture, and immune tests such as the tuberculin skin test or interferon gamma releases assays. Combining these methods provides a more complete picture and helps ensure accurate diagnosis. In summary, a PCR test for tuberculosis is a powerful molecular tool that detects the genetic material of the bacteria quickly and accurately. It helps clinicians confirm TB infection faster than traditional methods, especially in challenging cases. If you think you might have TB or are at risk, it's always best to consult healthcare professionals who can recommend the most appropriate tests and treatment options based on your individual situation.